Hi everyone. So you might have seen many videos about Chat GPT on different social media platforms regarding how to frame your email, how to write ebooks, how to have the blogs made, how to upgrade or how to improve your profile or maybe the CV. So there are many videos as well as the advertisement right now, and the YouTube is flooded of these videos. But this video is somewhat unique and is special for the healthcare professional, mainly doctors. Right, so in this video, I'll tell all the doctors over here on my channel that how this chat GPT can help improve the patient management, right? As well as improve your medical knowledge, which can help in your medical examination, right? Or maybe help improve your career as well. So this will be very interesting for all the doctors over here or maybe the nurses over here on this particular channel. So let's just dive into this video. So there are many controversies going on about the AI, about the chat GPT, whether this is good for us, for all the human beings, or is it dangerous, right? So, but I feel we need to take out positive from all the resources available to us, right? So we can't rely whole of it on chat GPT or any other AI, right? Because human touch is still there. I mean, that is which can't be replaceable, right? It can't be replaced for sure, right? But obviously it can help the healthcare professional to act in a better way or to help them get to the diagnosis or to the treatment or in many other forms, right? So starting with it, the first and foremost is always the management, right? So we keep on getting patients in our OPDs, in our wards, emergency, so wherever you are working, right? And these kind of patients, they have multitude of complex comorbidities, right? Having diabetes, heart attack, renal impairment, liver derangement. So there are many things, right? Having thyroid problems. So now what the thing is, you are sometimes not able to evaluate that this can be the problem, side effect, dose modification required, or the drug interaction. So there are many things, and these answers are not available on Google. Obviously, that will be written on in the whole text that this is the side effect, this is the contraindication. But if you have multiple drugs, multiple problems, then it is very difficult to find on Google. Obviously, there are thousands and millions of articles and reference books, but obviously that profile which the patient is coming to you is difficult to find on Google. And that is what ChatGPT AI, although this one is just the beginning of this new era or the revolution, right? I'll not say this is the best one. This is just the beginning, because I have seen ChatGPT. It is around 80%, I would say, is correct. 20% are still at the times where the answer is not exact, which we have read in our literature or which is in actual clinical terms, right? So, but we just need to have some points from ChatGPT which will help us. Now, without wasting much time, I'll just start. Let's say you have a patient, 60-year-old male, who comes to you and who had episode of heart attack 2 years back, right? And now this patient came to you with polyuria. And this patient on evaluation has fasting blood sugar of, let's say, 155. The HbA1c is more than 7, that is 7.2. There is renal impairment also. Creatinine is, let's say, 3.2. So what is the best OHA you need to start the patient on? So when this complex thing comes, so sometimes you take some time or you can get confused, right? So this will just help you decide which is the better management. Obviously, you are the best judge. Clinical condition, clinical situation, clinical signs, clinical symptom, palpation, examination, everything to be done, right? You have to examine the patient, and that is what is human touch, and nobody can replace doctors, right? This is what I feel. How much powerful AI comes, nobody can replace a human touch. Okay, now, first of all, I'll just write patient with polyuria, fasting blood sugar, which I just mentioned was, I guess, 155 milligram per deciliter, HbA1c of 7.2%, and creatinine 3.2 milligram per deciliter. He had heart attack 2 years back, which is best OHA or oral hypoglycemic agent in this case. Let us see what ChatGPT has to say. Okay, so this started when the first line which they mention is, I'm not a doctor. So obviously you have to consult a healthcare professional. If you are a layperson, you have to consult. So don't rely on this ChatGPT or any AI which is available right now, right? So further, what they mention is, however, given the provided information, it appears that patient has elevated blood sugar, HbA1c, indicating suboptimal blood sugar. Obviously, there is poor glycemic control. Additionally, there is impairment of kidney function with creatinine, which is on a higher side. So consideration with selecting a medication. In this case, it is important to consult a healthcare. Okay, fine. Now, further, what they have mentioned is it may be advisable to consider OHA that has low risk of hypoglycemia, does not negatively impact kidney function, and has cardiovascular benefit. So, some possible option to include is SGLT2. So, they have mentioned SGLT2 inhibitors or GLP-1 agonists, right, which may have demonstrated cardiovascular benefits and may offer renal benefits. So, you got to know that yes, the drug which can be used in this kind of patients can be SGLT2. Obviously, you know about gliflozins. This is having all the guidelines nowadays say you have to go with gliflozins, right? Whenever there is a cardiovascular risk factor. Now, I'll just ask which gliflozin to be selected in above case. I'm just trying. I have made a hypothetical case and let's see what ChatGPT has to answer. Okay, so in this given case where the patient has elevated fasting blood sugar, HbA1c, this is the information which we provided, and these are the three drugs they mentioned: empagliflozin, canagliflozin, and DAPA, and they have even given the brand name. I mean, wow, this is really interesting. I can see the Jardians written, right, and this is what we prescribe day in and day out, and also DAPA is 5-6. So they have given the brand name as well. So this sometimes becomes useful for us. And further, what they have mentioned is these medication has shown effectiveness in lowering blood sugar levels, reducing risk of cardiovascular events, and providing potential renal benefits, right? So this is what they have provided. And let's say I select about going with empagliflozin. What is the dose to be selected for empagliflozin in this case? I mean, again, I keep on saying, please do not rely on this. Okay? This is not the exact. Please do not rely on this. This is just information. This is just a help which we are trying to get from ChatGPT. Okay, so they mentioned the usual recommended starting dose of EMPA with type 2 is 10. Wow, great. I mean, I'm so impressed with this one. So they are also telling the starting dose, the dose can be increased to 25 if additional glycemic control is needed. So this is what we need. Further, what they mentioned in this case of impaired kidney function, dose adjustment or careful monitoring may be required. EMPA generally require cautious use or dose adjustment in a patient with renal impairment. So obviously, now you get to know you have to use EMPA. You need to see the EGFR, and accordingly, you need to prescribe the drug, right? So this is just a help again in this particular case. Now, if we go further and I ask, can we add metformin to this patient? Because that is the very first drug and first line whenever we talk about diabetes, right? We prescribe as the first one, but they have not provided why. Metformin is commonly used as, okay, they have written that also, first line oral hypoglycemic agent in the management of type 2. It works by reducing glucose production in liver and improving. So they have told the mechanism also. Further, what they mention in this paragraph is, however, in the case of impaired kidney function, creatinine 3.2, it is important to be cautious with the use of metformin. Metformin is primarily excreted by kidneys, and accumulation can potentially increase the risk of lactic acidosis. So wow, again wow. So they are giving you that kind of information that there is a possibility of lactic acidosis. You need to be cautious. And although yes, they have not gone so far that less than 30, if EGFR is less than 30, that it is contraindicated. Whereas in 30 to 45, you need to be cautious and you need to be keep on checking the creatinine function while the patient is on metformin. So this is the add-on. I mean, the information which we have from our reference books, so which they have not provided, but this they have just given a basic or the gross idea, right? While you are working your OPD, you have your mind somewhere else, or you're not able to recollect. So yes, this is what it can help. Now, if we go with the second example, I'll take the example of a patient who came to you with palpitation. Right, a healthy adult having a normal BP came to you with palpitation, and on ECG you see there is irregularity. Right, so that irregularity seems to be atrial fibrillation to you, and heart rate, let's say, is 120 per minute. Let's say what Chat GPT has to say, and you decide in your mind and think about this particular condition, which is the first drug you will choose. Now, the patient with palpitation has atrial fibrillation. I have to write full atrial fibrillation, although I'm not fond of typing atrial fibrillation. Not has, in fact, diagnosed with atrial fibrillation, or you come to know that this is diagnosed with atrial fibrillation, and heart rate was found to be 120 per minute, and blood pressure, which is somewhat normal, 120 by 84. Right, so what is the management? What is the management? Now let's see what ChatGPT has to say. Okay, so again, they have started with the very first line, I'm not a doctor, but I can provide some general information. So again, this is general information which we are looking forward to. And very nicely they have given. I mean, I'm so happy to see the first thing which is mentioned as rate control. And sometimes we get confused and we keep on giving amiodarone, right, as a rhythm control. Although yes, amiodarone causes rate control as well, but it is not the first to be selected. To increase the prognosis of the patient and for the betterment, whenever your heart rate is more than 110 or maybe 100. So what they say for the management of atrial fibrillation, it is less than 100 or maybe less than 110, right? So then you can go with rhythm control, but otherwise always the first line remains your rate control, and this is what they have mentioned. I mean, I'm so happy to see that. I'm just having the hypothetical situation while making this video. I've not tried it. So rate control, the initial goal is to control the heart rate and prevent it going too fast. Medication include beta blockers, metoprolol and bisoprolol, or CCBs, having dilzep and verapamil. Very, very rightly mentioned. It can be prescribed. Although, yes, what I will add to this particular line is you can even go with the amiodarone for rate control, but it is not to be used for a prolonged therapy. Not to be used for a prolonged therapy to control the rate. Amiodarone is always used for rhythm control. Now, let's see the second point. So, second point they have mentioned is anticoagulation, although I would prefer, and in fact, what the guidelines is having a rhythm control as the second one. So let's reach rhythm control. In some cases, restoring and maintaining normal sinus rhythm may be considered. This can be achieved through the use of medication to convert the heart rhythm, antiarrhythmic, or procedures such as cardioversion or ablation. And then they have mentioned about the anticoagulation, and I can see they have mentioned DOACs also, direct oral anticoagulant. These are now the first line agent for a non-valvular AF, right? For a valvular, it is still warfarin. So they have mentioned both warfarin or DOACs. So just a gross and general idea, right? That this is how you need to go ahead having rate control, and you need to think about anticoagulation also, because you can't just manage a patient of AF. You have to think, and there are full guidelines, right? How to go with the anticoagulation, having all those CHADVAS score and everything, right? So rhythm control and underlying condition management and lifestyle modification. So again, that general idea. So now we have seen the management of palpitation comes out to be atrial fibrillation, how we need to go ahead, right? Now, if we talk about the drug interaction, let's say a patient is taking many drugs, right? A combination. So what any kind of drug interaction though in that, or you need to just replace any drug from that. So let's say a patient is hypertensive, is also of having atrial fibrillation, this same patient. So we have discussed about the atrial fibrillation. This is in a healthy patient. Now, for atrial fibrillation, let's say patient is an amiodarone, and for the and there is a valvular AF also. So you have prescribed warfarin also to these kind of patients. And then the patient is hypertensive, you are giving amlodipine, and also there is a history of seizure, so patient is on valproate. I mean, this is the combination, or any drug which you are thinking to add, right? For a seizure, let's say you are thinking to add for a valproate. So is there any kind of interaction in these combination of drugs? So I'll just try. So having amlodipine, I'll just try with it, amlodipine plus I mentioned about amiodarone for the rhythm control plus warfarin plus sodium valproate. Can we use these drugs together? Okay. So they have written again, I'm not a doctor. Yes, we know you are not a doctor. And so again, they have started. So here is the answer. Regarding the combination, what they say, amlodipine is a CCB used to treat high blood pressure and certain heart condition. It is generally low potential for significant drug interaction. Very well said, right? So the amlodipine has very less of drug interaction. Amiodarone is an antiarrhythmic drug used for irregular heart rhythms. It can interact with other medication like warfarin, leading to increased risk of bleeding. Very well said, very well said. Close monitoring of patient INR is usually necessary when using amiodarone and warfarin together. Again, very, very rightly mentioned. So warfarin is anticoagulation used for to prevent blood clot formation, which we all know that. These interaction, so it can interact with various medication, including amiodarone and sodium valproate. So it can have interaction with both, right? So these interactions may affect metabolism and clearance of warfarin, potentially increasing the risk of bleeding and decreasing effectiveness. So very well said, right? So you need to think, whenever the patient is on warfarin, yes, there can be problem with the drug interaction, and there are chances of a bleeding in these kind of patients. Again, they have emphasized just in a basic line or the basic terms. Sodium valproate, anticonvulsant used to treat seizures are bipolar. It can, yes, bipolar, very rightly mentioned. So first drug of choice, I mean, this is the information which I am providing. First drug of choice for bipolar is lithium, right? Second alternative, if let's say the patient is of renal impairment, you should not go with lithium. The better would be sodium valproate. That is the alternative. And the third one is atypical antipsychotic. So this is the three. I mean, I just read bipolar and sodium valproate. So this is the information which I am providing to you. They're not from the Chat GPT. Okay, it can interact with other medication, including warfarin, potentially affecting warfarin's anticoagulation. So again, the same thing. So you need to consider about the drug interaction. This is the information. Again, good information which has been provided by Chat GPT. Now we have discussed about how this Chat GPT AI is helping us in the treatment, and just letting us know that yes, these are the points which you need to emphasize or re-emphasize, right? You know it, but just for the re-emphasization, that's it, right? It's not, we can't rely. And if any layperson is watching, or a non-medico is watching, please don't go with the treatment option which we are discussing over here, right? I mean, you can't rely. You have to go with the healthcare professional. This is a big disclaimer of this particular video, right? So having said that, now we have talked about the treatment. Now, if we have to search for the other causes, right? So as a differential diagnosis, let's say a patient comes to you with fever, with the right upper quadrant pain, and also, I mean, the other thing which we can have is the raised enzyme, liver enzyme, right? SGOT. So let's see what ChatGPT has to say as the other causes or the differentials for this kind of patient. So patient causes of fever plus right upper quadrant pain plus raised ANT, AST, SGOT or SGPT. So we just need to know the other causes or the differential diagnosis, right? Now, what they have mentioned is combination of fever. Okay, I'll just read it again. Combination of fever, right upper quadrant pain, and elevated enzymes can be indicated of various conditions affecting the liver or the biliary system, very rightly said. And the first differential they have provided is hepatitis, okay, which can be A, B, or C, or cause liver inflammation leading to elevated liver enzyme and associated symptoms. Cholecystitis, liver abscess, yes, this is what I was thinking, right? While framing this question, I mean, while having this hypothetical situation, this is what I was thinking. Having the fever, right upper quadrant pain, and raised liver enzymes. So, liver abscess is there, biliary tract obstruction, having obstruction of the bile duct due to gallstone tumor, or can lead to right upper quadrant pain, fever, and liver. So a liver injury, also a liver metastasis. So what else do you want, right? I mean, they are helping you with a good amount of list with a combination. On Google, you can have many causes for raised DST. I mean, there's an approach. You have to go with seeing the, first of all, the bilirubin conjugated, then whether the enzymes are normal or raised or increased GGTP. So there is full algorithm for it. But that is only for the liver enzymes. If you add on, patient has a fever plus right upper quadrant pain, one can be the differential diagnosis. And here the answer is, I mean, you can add more problems, more comorbidities, and this will help you just with the basic or general information so that you can't miss. You should not miss the other points. Now let's take another example for the differential diagnosis of the causes. Let's say a patient has causes of, I'll not write patient again and again because the first line it will mention is I'm not a doctor. Right? So that is why I'll not use the word patient. Causes of, let's say patient has headache plus stiffness in the body, plus raised ESR or CRP. So this is what I thought as having a headache, jaw claudication, raised ESR, raised CRP, having stiffness in the body in the early hours. So I am thinking about GCA, right? So let's just see what this ChatGPT has to say. Just see. Okay, so this has provided a good list, and the first one which they have provided is GCA, temporal arthritis, known as GCA, giant cell arthritis. I mean, I'm impressed. Right, that is the first differential diagnosis they have given. And they have mentioned inflammatory condition that primarily affects the large blood vessels in the head, particularly the temporal arteries. It can cause severe headache, scalp tenderness, jaw pain. They have also written jaw pain. So that is actually the jaw claudication. So having headache, jaw claudication, raised ESR, raised CRP, and stiffness. So this is a combination which you have in GCA. The other differential which we know, I'm not seeing the list, so is PMR. So let's see whether the PMR is yes. So at the fourth point, they are given PMR, polymyalgia rheumatica. So this is an inflammatory disorder that primarily affects the muscle and joints, causing stiffness, pain, and elevated ESR. Headache can also be present. Majority of cases, headache is present in temporal arthritis or GCA. In this, you have in PMRI, this is the information which I'm adding, having a problem in the shoulder as well as in the pelvic area. Right? So this is how they present. Then the other differential is meningitis. Obviously, you have to think about meningitis whenever you talk about headache, but stiffness, I have not cleared which kind of stiffness. Mainly, it is the neck stiffness they present with, right? And so they have, in fact, written that also, headache with neck stiffness and elevated. So I'm so impressed with this one. SLE, RA also, yes, RA can also present in the similar manner, having elevated ESR and the affecting the joints, and then the infections. So again, very, very good. Now, if we want to go ahead and we have these kind of patient, let's say in the patient which we discussed of liver abscess, right? And we need to know what kind of investigation we have to run for catching up that liver abscess. So let's say investigations. So I'll not write investigation for liver abscess. You have to write all the presentation investigations required for patient. I'll use patient with fever, right upper quadrant pain, and raised liver enzymes. Let's see again what ChatGPT has to say. Okay, so thankfully they have not started I'm not a doctor, because still now we know this ChatGPT is not a doctor. A doctor is trying to use ChatGPT and is just seeing whether ChatGPT is able to help us in re-emphasizing the facts, right? So the test which they have provided is CBC, the blood test, about WBC and differential, which can indicate infection or inflammation, very rightly said. LFT can assess the level of liver enzymes. Obviously, we have to go ahead with that. Additionally, viral serology, yes, hepatitis A, B, C, autoimmune markers, inflammatory markers, that CRP and ESR may be ordered, right? Imaging studies, obviously you have to go with imaging. When you are thinking about that, it's not just the blood test, you have to go with imaging. And what they say is abdominal ultrasound is the initial imaging modality. Very good, very, very split. I mean, very well written, in fact. Initial imaging modality used to assess liver, gallbladder, and bile ducts. Can identify the abnormalities such as gallstone, liver abscess, or bile duct dilatation. If necessary, other modalities like CT or MRI may be ordered for further evaluation. Hepatitis viral serology, yes, that is also needed. To very rightly said, is testing for the viral markers. Autoimmune markers, ANA and ASMA can also be used for autoimmune liver disease. Yes, this is what you need to think. If you have ruled out the common causes, hepatitis and all those, obstruction and everything, right? Biliary tract, you have seen everything called bladder, biliary tract, you have ruled out. Then you have to think about autoimmune hepatitis also. Liver biopsy in the as a last resort. In some cases, a liver biopsy may be recommended too. Again, this is collective information. Although, again, it's just a basic. It is not a full information. It is just a basic. Now, we have talked about how this ChatGPT is helping us in the managing in the treatment, in finding out the differential diagnosis or the other causes, and also to go ahead with the investigation. I can have a various permutation and combination of having symptoms and drugs and all those. And yes, it somehow works for that. And it's not exactly the same, but yes, somehow. Now, talking about the fourth one. So I talked about 5 points, and the fourth one is for the medical students or for the nursing students. Now, when we are going ahead with the MCQs, right? So we somehow know that this is the correct option, this is the correct answer, but we are not sure about the other options, right? So which one is the correct one? So if you just come across a question and you don't know, there is no answer given to it, or there is no such explanation, so we can try that. So I'll just go on to and I'll just open my mock test, which I keep on having for all my MRCP candidates, right? So which is by the name of IMAT. So Intellect Medico's Assessment Test. And this is a mock test, usually grand mock test for all the MRCP candidates having majority of medicine, right? All of medicine, in fact. Now, wait a minute. I'll just open that and I'll choose just random question and see how this ChatGPT works over there. Okay. So IMAT, yes, I have opened that, all the questions. So let's just select 12th question. I just see 12th. Which one is it? I'm not seeing. Okay. This has an image. No, this doesn't have image. Okay. So I'll just select this one. And this is a question, as you can see over here, this is a question about toxoplasma, right? And the lesions are shown in the MRI. And what then they have asked is, which is the best treatment option for this patient? Now, if I go back and have this one, ChatGPT, I'll just copy paste this one, and then let's see what ChatGPT has to tell us. Okay, now what they say, I've not read the question, in fact, and I'm not wasting time for that. This is for toxoplasma. And now the patient clinical condition including HIV, symptoms of drowsiness, left arm movement problems, confusion, severe. So everything is being is written, suggest a diagnosis of cerebral toxoplasmosis. So they have given a diagnosis that this is the problem patient is having, right? And further, what they say is the treatment option involves combination of medication, which is pyrimethamine, sulfadiazine, and folinic acid. And what I always say is you can remember by a mnemonic SPF, right? So SPF is sulfadiazine, pyrimethamine, and folinic acid. So again, very well. ChatGPT, yes. So you have given the treatment also. The answer, it's not just the treatment. I have not written the treatment for cerebral toxoplasmosis. I have given full of the question, which is just like that in MRCP, right? Or any other exam, USMLE or NEET PT, any exam, AMC, DHA, whichever lab, whichever exam you are going at, you don't know the answer or you don't know the explanation. Just you can get the help from this ChatGPT. Again, please do not rely solely on this. There are certain situations, in fact, 2 or 3 questions I have tried around, let's say 15 or maybe 20. So 2 or 3 questions that were incorrectly answered by ChatGPT. So again, please do not rely, but yes, just see to it that whether the explanation is going along with it, you are able to see that or not. If at all you have a doubt, obviously consult your reference books. Let us select another one. So I'll go to 50th or okay, I'll go to the end of this exam, maybe in 90, something like that. Okay, let's select 96th question. I have not seen which is the question, but I am just copying this one and I'll paste that in my chat GPT. Wait a minute. I'll just paste this. Yeah. So paste it and enter. Now let's see what the answer is. I don't know the question even now. I have not read the question. Okay. So question it says 55-year-old presented saying he had coughed blood on several occasions. Okay, squamous cell carcinoma of the lung, which is the contraindication to surgical resection of a squamous lung carcinoma. And there are 8-9 points, right? Which you all know. You might be knowing that. Among the options provided, the asserted finding is contraindication to surgical with the contraindication that they have provided is SVC obstruction, and this is the option in the question, SVC obstruction, and this is the correct one. Obviously, SVC obstruction is a contraindication for a surgical resection of a lung cancer, and that to a squamous cell lung cancer or a large cell cancer. So, and they have given an explanation. So, SVC refers to. So, they have provided explanation to it also. Good. I mean, as the Chat GPT, I'm proud of you. You are coming up with the right answer at least, and also you are giving the explanation to it. Great. Now, so this is about the candidates who are going ahead with the MCQ based test. Now, for the juniors who are still in the MBBS or who have to go with a subjective test, right, where you need to write answers. I'm not going with the having causes and pathogenesis and treatment, because yes, that you can get in your Google, right, or maybe from your reference book, right, for a particular disease. Now, the problem which when we were doing our MBBS was having a difference table, right? So when the difference was asked, obviously it is very difficult to make all the points. Now, I'll just try with that on this Chat GPT. Having said that, starting with the cardiology, if we normally get a question about cardiac tamponade and constrictive pericarditis, so how to differentiate? I'll just write cardiac tamponade versus constrictive pericarditis, in a difference format. So I need to that in a difference format, not a. So let's see how they give it. Okay, so first they have given cardiac tamponade and now constrictive pericarditis, and they have given in the similar manner. Similar manner means first and foremost, the first point is definition. Over here is the definition. So this is how you start. Pathophysiology, accumulation of fluid in pericardial space, whereas over here pathophysiology is different, which is thickened and stiff pericardium restrict the normal expansion and filling. Then third point over here is symptoms and presentation are the signs. Similar goes with this one. Diagnosis is based on clinical presentation, physical examination, and all these things. Treatment is relieve the pressure on heart by performing emergency pericardiocentesis, right? So obviously this is the treatment for cardiac tamponade. And treatment over here, it involves medical management with diuretic to control symptoms. In some cases, surgical pericardectomy, the removal of thickened pericardium may be necessary to relieve constriction and improve cardiac function. So again, they have given a difference table. I mean, not a table, but yes, all the points in a similar way so that you can present in a. Now, the other one, if you talk about the neurosystem, let us see about myasthenia gravis versus Lambert-Eaton. Difference format. I hope I have not made any writing mistake. I mean, difference. So there is a spelling mistake over here. Lambert-Eaton. Okay. Now, ChatGPT is providing us the answer. First started with myasthenia gravis. Let's see and let's compare. This will be the last one for the medical students. Okay. So, definition, obviously, myasthenia gravis, pathophysiology. This is how. Diagnosis, if we go ahead with diagnosis made by clinical evaluation, specific tests such as, AChR antibody they have provided, acetylcholine receptor antibody, and RNS, as well as the EMG study. Very good. And then, obviously, they have given the Tensalon test, which is not used nowadays. So, they have provided about the diagnosis. Let's see the diagnosis for LIMS. This is how we differentiate. So diagnosis includes a clinical evaluation specific antibody testing, which is VGCC. Yes, very rightly mentioned. Anti-VGCC and EMG finding. The RNS shows an incremental response, and this is the main difference, right, of the presentation or the diagnosis. That in LMS or LES, Lambert-Eaton syndrome, what happens is there is an incremental response to a RNS repeated nerve stimulus. Whereas in myasthenia, it keeps on decreases. There is a decremental response. So you have to go with RNS studies, which is given over here. Over there, you will need to go with ACH receptor antibodies test. Over here, you have to go with anti-VGCC. So again, and then treatment, they have given, okay, they have provided 3,4-diaminophaldine also. I mean, very, very good. Again, wow. Wow for this one. And for treatment, multidisciplinary approach, medication, you have to go with pyridostigmine, immunosuppressant, corticosteroids, azathioprine, IVIG as well they have given. And they have provided, they have written about thymectomy also. So good. I mean, it is a good explanation on a good difference which you can write in your theory papers, right? And the other one which I have also searched, let's say the mnemonics when we are reading, when we are preparing for our theory or maybe for the MCQ, is the mnemonics. Obviously, you can search mnemonics on Google. I'm in this video, I'm emphasizing on the facts which you are not able to get on Google, right? So mnemonics you can, but yes, this also provides a mnemonic as well. So you can try with that, right? Having about Alport syndrome or maybe Parkinsonism, any mnemonic which you feel it will provide one simplified version of the mnemonics which are there on the Google. Obviously, it again matters. Now, the last point, the fifth point for increasing and helping in your CV is always, or in your career, in fact, I would say nowadays is the articles. So how many written articles you have or a case study you have in under your name, right? How many have you undertaken that? So that helps you increase your CV, as well as if you have that kind of interest, you can go ahead with it, right? But the point is, you can't directly have the review articles written with Chat GPT. It's not done, right? Although I'm not, I'm not a fan of writing these review articles or having case studies or case series. My friend, Dr. Dinesh, who is a consultant and neurologist at Ola Hospital, is very, very fond of these review articles. So I just had a word with him that how ChatGPT is responding to these review articles. So yes, his input regarding the same is it is somewhat helpful to get the outline of review articles, not exactly the same. And this doesn't give references, and if at all, if you try for any kind of references, they are not matching with the text, right? So don't go ahead with that. Just go with the outline. Let's say outline for Alport syndrome. So yeah, an outline for review article on Alport syndrome. Let's see just the outline. Okay, so this is how you need to write. Again, very good description that these are the points which you need to mention. First, starting with, you have to go with the introduction, overview, brief background, significance of Alport in terms of prevalence, impact on individual and family inheritance, then clinical manifestation, how they present renal impairment. We all know that. Ocular normality, that too, anti-renal antagonist, which you keep on getting in your MCQs, hearing loss, which is SNHL, then obviously extra renal manifestation, collagen 4 defects, genetics. So you have to emphasize it's not a review article. Obviously, they are giving you just the outline, the points. You have to cover that. And you have to see the literature and relevant information to be added according to the references. And your review article is done. I mean, you are done with it, right? So this will just help you with the outline. That these are the points you need to mention. You need to search for the literature, and also goes with the case study. Also, it will give you the outline. So this is how you can. I mean, this ChatGPT can help with your review articles or the case studies. And in totality, all these 5 points which I discussed, I think this will help all of you, all the doctors over here, to increase their knowledge, not increase, or in fact to apply in the medical terms, and just to re-emphasize the facts, right? Obviously, you all know those interaction, those treatment that you all know. Gliflozin is the treatment of choice whenever you have cardiovascular risk factors, right? Whenever the BMI on a higher side, that you prefer is the GLP-1 analogs, right? So you all know that. But just to re-emphasize, and whenever the multiple problems come, multiple comorbidities come, sometimes we get confused, right? So as to have that information, or having a differential diagnosis, different differential diagnosis, so that you should not miss anything. Right? So you can just help from Chat GPT so that you are not missing out something. So this is what I have to give you with this session on Chat GPT for doctors. Right? I hope you find it helpful, and I hope this will help you in your medical management, also in your professionals as well as in your MCQ examinations. Okay, bye bye. Take care.